Hello there, my name is David Thurtle. I'm one of the registrars in urology at Peterborough City Hospital. I'm here today to talk you through information and the consent form for a rigid cystoscopy and ureteric stent insertion. There are a number of reasons that we insert ureteric stents. Most commonly this is because of a blockage to the ureter, which is the water pipe which drains the kidney into the bladder. This can often be blocked by stones or scarring, known as a stricture. Sometimes it can be blocked by a tumour in the bladder or in the water pipe or in the prostate. Alternatively, we sometimes leave stents in place after a procedure in the kidney or looking inside the ureter. The procedure involves a cystoscopy, which is a look inside the bladder whilst under anaesthetic. We use a rigid instrument to look through the water pipe and into the bladder, and then through this instrument we are able to insert the ureteric stent. As part of the procedure we often use X-ray to help make sure that the stent is in the right place and to potentially diagnose other problems at the same time. A stent itself is a thin silicone or composite plastic tube. It has two curls on, one at each end. These curls help to keep the stent in the kidney and draining into the bladder. The stent helps urine to pass through it and around it to relieve any obstruction and help to bypass that obstruction. Stents can be left in situ for a short while or a longer while, depending on the reason that they've been inserted. They should very rarely be left more than 12 months in total. Alternatives to inserting a ureteric stent do exist. Sometimes you can conservatively manage the problem, such as a stone sometimes can pass through on its own without the need for a stent. Alternatively, sometimes we can insert a nephrostomy, which is a tube directly into the kidney, which drains the urine directly through onto the skin of the back rather than draining urine into the bladder. These are potential alternatives but may not be relevant in your case. In terms of the details of the procedure itself, a stent insertion is usually performed under general anaesthetic. Sometimes it can be performed under spinal anaesthetic, and very rarely is it performed under local anaesthetic. Whilst you're anaesthetised, we often give you an injection of antibiotic to reduce the risk of infection after the procedure. We then use local anaesthetic and lubrication jelly to insert a small telescope into your bladder. We then inspect the bladder to see that there's no other obvious abnormalities. Then, using X-ray guidance, we insert a guide wire and then a stent into the kidney and use special equipment to ensure it's in the right place. If your stent only has to be left in place for a few days, we sometimes leave the stent with a small string attached to it so that we can remove it very easily without a further procedure. This is only the case if your stent is to stay in place for a short period. Usually you are not able to see anything on the outside following on from the procedure. At the end of the procedure, we usually empty the bladder. Sometimes we may leave a urethral catheter inside the bladder to drain away any urine. This can help to reduce the risk of infection, and sometimes is necessary if you have significant bleeding or it's very difficult to get into the bladder. In terms of after effects following on from the procedure, there are very common after effects, less common, and some very rare side effects or risks. In terms of common problems, it's very common that it will burn and sting when you first pass urine after the procedure. This often settles down after a few days. For some patients, they will get significant symptoms related to the stent. These symptoms can be irritation to the bladder, meaning you feel you have to go to urinate more often. You may get pain from the bladder, particularly on urination, and you may get some pain to the side and up to the kidney on urination also. Approximately 4/5 of patients have some sort of symptoms from the stent, and 1/5 will not feel any symptoms from the stent itself. These symptoms tend to settle when the stent is removed. Some patients will require a catheter inserted at the same time of the procedure, and this can cause symptoms of pain, discomfort, and the sensation of frequency or a full bladder. A further procedure is often necessary after a stent insertion. This depends upon the reason for stent insertion. You may require a cystoscopy under local anaesthetic to remove the stent if it was put in for a short-term reason. You may require a further procedure on the kidney or the water pipe if the stent was inserted for a different reason. For instance, if the stent is inserted because you have a stone that is blocking the kidney, you may require a further procedure to access the stone and break the stone up with a laser. Uncommonly, you can have infections after this procedure. We will give you an antibiotic at the start of the procedure to reduce the risk of this, and it's important you stay well hydrated and drink plenty after the procedure to reduce the risk of this. For some patients, we may send you home with oral antibiotics after the procedure. Despite this, some patients will get severe infections, and if you have signs of an infection such as a fever, ongoing stinging or burning on passing urine, you may require further antibiotics and should seek medical attention. Occasionally, in less than 1 in 10 cases, we may struggle to pass the stent. This may be because of a very severe obstruction, and in which case it may become necessary to do an alternative procedure such as a nephrostomy, which is the insertion of a tube directly into the kidney through the skin. This would not usually be done at the same time, as it is a separate procedure performed by a different team. It can be possible to get delayed bleeding after the procedure, and if this bleeding is severe, you may even require a further procedure to clear the bleeding and remove any clots from the bladder. This is very uncommon in less than 1 in 50 cases. Also very uncommon is injury to the water pipe or to the bladder itself, or even to the kidney or the ureter which drains the kidney. This can occasionally lead to scar formation and require further procedures or catheterization in the future. Separately, you may have risks associated with the anaesthetic, which the anaesthetist should talk you through. Occasionally, on performing this procedure, we may find other abnormalities within the bladder or within the water pipe. If we were to see something suspicious, we may take a biopsy at the same time. After the procedure and before you go home, it is important that you are able to pass urine before you leave the hospital. The surgeon or part of the clinical team will usually come and explain to you what was found and what the plan going forward should be. It is generally not advised to drive after the procedure, particularly if you've had a general anaesthetic, and you should be supervised for 24 hours after the procedure if you've had a general anaesthetic. It's important you drink plenty of fluid the first day or so after the procedure to keep everything flushed through and to reduce the risk of infection. You may initially have some pain related to the procedure, which may settle, and taking simple painkillers such as paracetamol is usually very sensible. You should be aware of the follow-up plan and the plan with regards to the stent after the procedure. It is very important that stents are not left in place very long term, and so if you are unsure what the plan is in terms of removing the stent or a further procedure, please ask your clinician. The vast majority of patients tolerate a stent quite well and find the procedure is not as bad as they were expecting.